Hello everyone, it's Dylan Rodriguez. I'm continuing on my research question on whether the turbo suction catheters for mechanical ventilated patients are better than the original suction catheters. As a little recap based on my first video, the difference between the turbo and the regular is the turbo, you're able to separate the catheter from the patient and clean it with saline. That way you're not sticking a dirty catheter back inside the ET tube. And the goals are to prevent ventilator associated pneumonia, which if a patient acquires ventilator associated pneumonia, then the hospital is liable for that because it's an infection that we caused. But doing some research, most of the studies that I've been able to find, I haven't really found a lot, just that they call it the turbulent cleansing action, which is where you actually clean the suction catheter with the turbo cleaning suction system. It says it results in an 89% cleaner catheter tip compared to the standard closed system suction. This reduced colonization may help reduce the risk of VAP, which is ventilator-associated pneumonia, in ventilated patients. Obviously, since if a patient develops ventilator-associated pneumonia and the hospital has to take the bill on that patient, it's obviously a big charge. So this is something that's pretty important to hospitals to try to eliminate. In theory, if you look at it, yeah, cleaning a suction catheter should reduce the risk of this VAP. Also, it's also recommended that you change these catheters every 3 days, so that way you can get rid of the bacterial growth and stuff like that could affect a patient's lungs. But there's also many other factors that go into the ideology of preventing VAP, which is the ventilator circuit clean? Was there any disconnection between the ventilator and the patient, which could introduce bacteria? The thoughts between a heated wire circuit, which versus a HME, and HME is only supposed to be used for temporary patients, but since I've been working in the healthcare system since 2018, the majority of patients use a HME, which is a heated moisture exchanger, which catches the patient's breath, catches the heat moisture and gives it back to them, versus a heated wire is actual sterile water being heated through the circuit to provide humidification to the lower airway. But I'm looking forward to doing more studies and looking into this and seeing what kind of data there is between patients that are using the turbo suction system versus the regular inline suction system. A lot of the hospitals around me and hospitals that I work at, they've recently been switching over. So yeah, I'd like to discuss it with a medical rep. They come around and they're the ones that sell these products to these hospitals. So hopefully they'll be able to provide me with more information and more data as to what the actual numbers are and what they're seeing. I've heard from medical reps that it's almost a 90% decrease in ventilator-associated pneumonia versus hospitals that are using the regular suction catheters. So it's going to be interesting to see. Thank you.